As new data shows 1 in 500 Americans has died from COVID-19 and the Delta variant continues to surge across the country, the next challenge many healthcare leaders face is within their own staffs, the 27% of you. As healthcare workers who have not been vaccinated against the disease as of July. On top of that, other research shows that since the vaccine first became available to healthcare workers in December 2020, the rate of vaccination among nurses and nursing home aides has been lower than physicians. This may be of particular concern, since nurses and aides have such frequent and close contact with patients. Data shows healthcare workers have gotten the COVID-19 vaccine at a higher rate than the general population, 73% versus 64% of non-healthcare workers. And many may assume that people who work in healthcare industry are more enthusiastic about the vaccine, and less apprehensive. But that has its limits, says Lazer of Northeastern University, the lead researcher on the COVID States Project report. The attitudes of healthcare workers toward the COVID-19 vaccine essentially mirror the rest of the country, with those living in rural areas, who are Republican, with less education and income more likely to be vaccine resistant. The big takeaway for us is really that healthcare workers are like Butler, a nurse at Long Island Community Hospital in New York and the executive director of the nonprofit Nurses Who Vaccinate, says she has heard from nurses around the country about why they don't want the vaccine. Among the reasons, the research was done too quickly, it wasn't fully FDA-approved, they already have antibodies from working the front lines of the pandemic or perhaps getting the virus already. Many are concerned about how the vaccine affects fertility. To be clear, all of these concerns have been addressed by scientific experts and the overwhelming evidence is that the COVID-19 vaccines are safe and effective. But Butler points out that widespread misinformation plays a role here, too. And nurses are not talking ins and outs of vaccine research.